This is, all right. So this is chapter 13, and we continued with IV medications and parenteral infusions. This chapter is calculating IV meds and infusions, and the whole purpose of this chapter is to give you an idea of the different IV medications that we give, and also how we put them in infusions as well. So we're going to talk a little bit about the different, you guys see the big bags of fluids that the patients get. The most common one would be normal saline, when they say normal saline. So those are considered large volume infusions, because it's it's a large, anything greater than 500 ml is considered a large volume infusion. And then we have other infusions that come in smaller bags, and that's normally where we mix medications. And those are the smaller type of infusions. They could be 250 or less milliliters. So for primary IV right here, the purpose of this, a large volume, where I'm going to start with a large volume. The large volume, the purpose is to give a continuous infusion. So normally these are patients that have the bag. The most common is 1 liter, and which is 1,000 milliliters. And they normally have a continuous infusion of anywhere, 75 ml a minute or an hour, I'm sorry, 75 ml, depending, according to whatever the rate the doctor has determined. And the rate is determined based on the patient's condition. Okay, so the patient might have a heart condition and they can only get 50 ml an hour infused. So they have this as a continuous infusion. We also call it maintenance, like for maintenance. Some people are not eating anything by mouth, so we have to give them electrolytes, and we have to give them, maintain a maintenance on their body, right? So that's the purpose, and normally that's for the large. This is a large volume infusion. Then the components of your IV, when you get, I'm sure you guys have all seen IVs and have seen the tubing and everything. I do want you though to memorize the components of the whole intravenous set. And normally it's a tubing like this. I'm sure you have seen it. And the part that is proximal to the IV, which is where the one that it connects to the IV. And then sometimes we have, this is a port. This is a port that we use to administer medication while they're having a continuous infusion. They might be having something continuous. So we give them we can inject medication from here, and it goes directly into the vein. As it's going continuous, so it's continuously pushing the fluid this way. So it goes into the vein. There's some IVs that have multiple ports. There's some that have up to like 3 ports, from the close to the IV side, and like they have 3 different ports. And the reason for that is that sometimes we give medications that we want them to be direct and to push faster, and some other ones we might want to give them a little bit more in the distal, like farther end, so that it can mix up and it doesn't go in as fast into the bloodstream. Then we have this that is called a roller clamp. We use this roller clamp to close, close the IV, or open it up, or like leave it halfway. And that is sometimes when we run it open or we have to count the drops, we use the roller clamp to control that. There's another clamp here that's a side clamp, and that one just slides to the other side and it clamps. It completely closes the line. That's another one. And then this is the one that actually attaches to the pump, to the machines. In the hospital, you're gonna see that every single IV, and they don't want us to free flow any fluids into the patient because of the error of causing a fluid overload or giving more than what's supposed to be administered. There's many type of errors that we could do by free flowing an IV. That means by giving a medication or infusing something on the patient without the pump and just free flowing it. Okay. And then this goes into the pump, and then we have the chamber, or the IV drip chamber, where you can see the drip here. The medication, the drops will start falling here on the chamber. And then the spike, this is the little spike. This is what we connect into the port here. Into the port here to connect into the fluid bag. Okay, So let's say, okay, here's my tubing. So, and then here's my bag. So you have the bag. All the bags, they have lines which show the markings, and it shows how many, some have, I don't know, they start on 1,000 here, and then each line is 900, 800, 700 until 100. So it's labeled, and then this IV label that you guys see here, that's colors, that it has different colors. We don't use these ones anymore. These ones were used before when we didn't have the pump, but every single line that you see here, it gives you a different, like for the most common and standards rates for IVs. Like if you want to give it at 75, if you want to give it at 100 mLs an hour, it tells you how to set it up. But we don't do this anymore because we use the pump. We use the pumps. And like I said, this is the port for the spike. So this is what connects to the tubing here. So we normally plug and insert the chamber, the spike into the port here. And this other port here that we have is normally covered. And the only reason why we uncover is when we have to add a medication into the fluid. So when we add it, there's a little rubber here, kind of like the little vials. We insert the needle, we insert the medication, and then it mixes into the fluid, and then it goes into the patient. So those are the components of the IV infusion set. So if I get an order, again, you guys have the medical record here, giving you a sample of an order, and it says 1,000 mLs of D5 normal saline. That's dextrose. That's dextrose sugar with normal saline with a little bit of isotonic solution, which is salty water. And the doctor wants to infuse 1,000 mLs of D5.5 and D5 of normal saline, excuse me, every 8 hours. So who can tell me what does this mean? Can somebody tell me what can you understand from this? Infuse 1,000 mLs of D5 normal saline every 8 hours. Can any of you guys tell me what would you understand from that?
From the order?
Uh-huh.
So the order is 1,000 mLs, dextrose 5%, normal saline every 8 hours.
Uh-huh. So 1,000 milliliters of this fluid are going to be infused on the patient. The whole 1,000 have to go in every 8 hours. So after 8 hours, we're going to start another 1,000, right? Because it says every 8 hours.
So is that like a pretty rapid drip?
It could be. If it's 1,000, I want to say it's going to be about 125. Oh yeah, acá está. In the bottom, 125 is not really. Most average adult patients have their IVs. Their IV fluids are going anywhere from 100 to 175. So it's kind of like, it's normal. It's pretty average. And again, we have to think maybe the patient's not eating. Maybe the patient's not, not having anything by mouth or any fluids. And our bodies the majority of our bodies is fluid. So we need fluid to keep maintaining our bodies, our systems. So that's kind of like a maintenance type of fluid. Okay, so this is a pretty common order. Okay, the different types of solutions that you guys are going to see, and I'm not gonna go over the different. I will post something so you guys know, but I don't think that's required for you to know right now. The different isotonics, hypotonic solutions. There are solutions that we give on the patient. For example, if my patient is very swollen, it has a lot of fluid retention, and the water normally, when we have this type of patients, I'm talking about a cardiac heart failure patient, somebody that's got really like heart disease, and the fluid is not really in the cardiovascular space. It's not really in the bloodstream. The fluid actually shifts outside of the tissues. So they're really swollen and very, very edematous. You can see the water in their tissues, and their legs are really swollen. The fluid is there, but it's in the wrong place. So the fluid is outside the cell. It's completely outside. So that patient is dehydrated. When you draw the patient's blood, the patient is totally dehydrated, the electrolytes are low, but you see that the patient's fluid, it's just in the wrong place. So sometimes we want to give him, an IV. The doctor might order an IV that has, high salt, like a high salt solution. And what that does is that the high salt solutions, what they do is they get the fluid from outside that tissue, the fluid that's shifted, they kind of pull it back into the cardiovascular system. So it's pretty cool. Like when we learn about the hypertonic, hypotonics, and isotonics solutions. When the isotonic solutions are these four that are here, and normally the isotonic solutions are, normal saline, I'm sorry, it's not here. Normal saline, the isotonic solutions are solutions that really don't do any changes on the cell or the water in the cell. The fluid goes in, it just replaces any fluid lost in the body, but it doesn't cause any shifting of fluids, or it doesn't cause any changes of the water in the cell compartment. So, and no, these are not all isotonics. The only isotonic here is the normal saline and the LR. Those are isotonic solutions. Anyways, but I don't think you guys need to know all the different in between all of those. We have to learn how much to infuse of each. So, and then here you see the rate of administration. The order said to give it over a period of 8 hours. So that's written here, and with medical terminology, Q8, 8 hours. And that's what that means. And then when we work it out, it's going to end up at 125 milliliters per hour. I think I have a problem here. These are other examples, you guys, of IV orders that you're going to see, and they're pretty common. This is 100 milliliters of D5 and 1/4 of normal saline at 125 mLs per hour. So the doctor might write it this way. Not only, this is one way the doctor could order it, infuse this much in every so many hours. Or the doctor might say, infuse 100 milliliters D5 blah, 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 at 125 per hour. So he's already given like a continuous order. It has to be 125 per hour. That's it. So every time it runs out, you just have to switch the bag. This is another order, 1 liter of D5.5, and it's got dextrose, half and 1/4 of dextrose with normal saline every 8 hours. And just so you know, guys, these bags are already pre-done. They're already we just have to choose the bag, with the type of solution. Then we have 100 mLs, 1,000 mLs of D5 and 1/4 every 8 hours. So it's written differently. I mean, we still have to be able to figure out how. And then we have this last one, 1 liter D5 and 1/4 of normal saline per 8 hours. So again, it has to be infused over that period of time per 8 hours. So you might see it written any differently. Okay, that's with the the large volume of infusions. When we talk about secondary IV infusions, these are also known as piggybacks or IVPV, intravenous piggyback. So you'll see both hospitals most of the time, most places we just call them piggyback. So they're known as piggybacks or secondary IVs. The secondary IVs, like I said, they're a smaller volume infusions. They can be 50 milliliters, a little bag, it's a tiny little bag. And normally the reason for secondary IVs is because we give medications. And normally these are not continuous medications. These are like if I'm gonna give famotidine, this is for the stomach, it's an acid reducer. If I give famotidine every 8 hours, so every 8 hours, I'm gonna go hang a secondary bag, and it's probably going to infuse within 30 minutes, and then it'll be infused. So that's what this means. Administered intermittently. So that means that antibiotics, for example, if the patient is in the hospital, he has a primary infusion going continuously, and then he has a piggyback or secondary infusion, the antibiotics that should be given twice a day. So in one of those ports, we from the primary bag, we connect the secondary bag, and then it'll infuse over 30 minutes or an hour, depending. We have some that are like the one that has the most is probably Vancomycin, which is a very strong antibiotic, and they dilute it a lot. And normally those bags come in like 250 mLs because it's a really strong antibiotic and it could burn the vein. So you might see that IVP bag orders are they're written pretty much the same, but you will see that they will include the name of the medication, the dose, the route. The route has to be there, and the time of frequency of the administration. So you see, this is Sofran ondansetron, which is for nausea and vomiting, 10 milligrams. So that we got the name, the dose, the route, and then the frequency now. So you'll see that they're written that way. So like I said, I told you that most of the time we use pumps. And then when we are using pumps, it's very nice, it's very convenient, it's super easy because this is kind of like an old pump right there, but the new pumps that we have in both hospitals, even in home health, sometimes we get some really nice ones. These pumps, they already have a software included. So they have a software. That means that when I enter the patient's, I enter the medication's name, that software already has like a pharma, like a drug, it's like a drug database. So it searches the medication for me and it tells me what's the safe infusion, like you should run it within 30 minutes or you should run it within an hour. And it can already preset it for me, which is pretty cool because it's saving my med math, right? It's saving all this med math stuff, but you want to also double check that is correct. But they have a really nice software that helps you. Like if you're giving a blood transfusion, it'll tell you how to start the blood transfusion. You start it slow at first, and then after 15 minutes, you start increasing. So you can preset the pump to do that for you. And normally another thing that's very cool about pumps is that they calculate milliliters per hours, okay? You will not be able to calculate a pump to do it drops per minute, okay? So that's the difference that you should know, a difference. Pumps calculate milliliters per hour. If in a question I ask you, how would you set up this on the pump? You will know right away that your answer is going to be milliliters per hour because that's how we set them up on the pump. Now we have by gravity. Gravity means it just, when I told you that free flowing, when you open the chamber and then the fluid starts coming, on its own, but you have to check the drops per minute. On that chamber, you can see when the drops are coming. So and then you kind of like calculate those drops per minute, which is what makes it complicated. At the hospital, it's unsure. Sometimes we do have to use drops per minute because in the emergency room, for example, sometimes we have patients that come in really sick and we have to like open up, or sometimes we're just so busy, we're out of pumps. We have no pumps and I have to administer Lorazepam over 30 minutes, on a patient. So sometimes we have to figure out the drops per minute. If there's a power outage or something goes wrong and there's no pumps, you have to figure out how are you going to administer that medication and, not be disabled. Oh, you know what? I don't have a pump. I cannot do it. I cannot work it out. So no, we have to learn how to do it. In home health, from my personal experience, I'll tell you, we have a lot of patients at home that have PICC lines, they have Mediports. We have to go and give them the medication at home. And depending on their insurance, and I know this sounds bad and sounds sad, but sometimes depending on their insurance, they don't get a pump. Most patients don't get a pump. Very rarely we have a patient that is at home and has a pump. And most of the time we have to do drops per minute. Okay, so normally that's in the tubing, and I'll tell you right now, the tubing, there's different types of tubings, and the tubing will tell me this is a macro tubing, and the macro tubing, it's 15 to 20 drops per minute. I'm sorry, and then you read it, and then I'll tell you how to calculate that. But I do want you to understand that we do calculate drops per minute in so many occasions. Maybe most of the time you'll be dealing with a pump, but if you're not, you have to know and learn how to calculate drops per minute, okay? And that very first time that happened to me, I was at a patient's home, and I was really like trying to, like getting to count the drops, and it was interesting. And after that, I said, oh no, never again. And you know, like I made sure that I knew what I was doing exactly so that it wouldn't happen, you know, that I was confused and I had to call my supervisor. It was like an experience to tell. So let's talk about calculating the rate with the IV pump, okay? So when the doctor gives us the order, we're gonna determine, right? We're gonna utilize in our med math, we're gonna determine what is the rate going to be. Again, what is the rate, the mLs per hour on the pump, okay? So we can do it using the different methods, but I'll show you the dimensional analysis only, and then we'll have to convert units if we need to. For example, like if I have to move from minutes to hours or hours to minutes, so we have to convert and utilize our conversion table for that. And then when we are calculating in an IV pump, the answer needs to be in a whole number, okay? So we have to be here, that's where the rule will apply. If you have an answer that's 15.5, you know that your answer is gonna be 16, because there is no way that you can set up the pump to 15.5. We have to go to the next. And if it's less than 0.5, we have to go to the lower whole number, right? So let me show you dimensional analysis. So let's see that order. It says 1,000 milliliters of D5 and 1/4 of normal saline over 8 hours. Okay, so we have to give 1,000 mLs over 8 hours. And it says, what rate will the nurse set up the pump? So this is the way that you guys are gonna do the conversion. First of all, you wanna the order amount will be on the top, right? 1,000 mLs, 1,000 mLs, and in the bottom you're gonna put for the time, how many hours. So that will be in the bottom. This one is pretty simple. It'll get more complicated. All you have to do at this point is there's nothing really to cancel out, because the rate in the IV pump, it's what? mLs per hour, right?
Que unas pastillas dice que no está jugando con él Gonzalo, está con tu teléfono Gonzalito, y digo, está fingiendo la voz, soy Becky, y le dijo, ok, estoy grabando una pastilla. Ahorita voy.
Sorry, I'm also taking care of my mom, and she has dementia, and she wants her pills. Okay, so where was I? So you see that is 1,000, the order, and over 8 hours. So when I'm saying what rate, remember that I'm talking about mLs per hour, right? Because I'm setting this in a pump. So I'm looking for mLs per hour. So really, I don't have to cancel anything out because I already have my mLs per hour, right? I don't need to put anything on my conversion factors because I already have it here. So all I have to do is divide the 1,000 over 8, which is going to be 125 mLs per hour. Okay? You guys are clear with that?
Yes.
Okay. If I need to add, like if I need to add a weight, for example, Fulanito weighs, I don't know, 16 pounds, and the doctor order, this is just, we're just calculating the fluid. Later, I'll tell you some other problems later on in which you have to add conversion factors, such as weight, such as, you know, I don't know, maybe the doctor said to give it over 8 times 6, over 460 minutes, and you have to use the conversion factor to convert it into mLs per hour, right? So I want you guys to work this problem. Let me grab my tablet. you guys figure it out? Audio? Are you guys there?
Yes, we're here.
Let's see. What do you guys get? Or my pen didn't charge.
I converted the 1 liters to the 1,000 mLs over 12, and then we divide it, right?
Mhm, mhm.
Okay, so. 12 1,000. It's a lot of zeros.
83?
Uh-huh.
Yay! You got it right. Sarah, did you get it right?
I'm still working on it.
Okay.
I have a question while everyone works. On the last exam, when you brought up weight right now, it reminded me, there was a question about, like we need to administer, I think it was like 15 milligrams per, I don't know if it was kilograms, and the patient weighs 10 kilograms. Is that when we're talking about using weight or?
Yes, that's when we're talking about using weights. So if that patient is 10 kilos and the doctor's order says 15 milligrams per kilogram, so you have to set up on your dimensional analysis on your setup, you have to add you have to convert the patient's weight if it's not converted into kilos, and then multiply it by the milligrams per kilogram. So I'll put a sample right now.
And we hadn't done that before, right? Or have we? Did I miss it?
No, we hadn't.
I think you know what it is. I probably didn't put as an example before, but what it is that we just use the conversion factors. That's all it is. You just plot them. I'm gonna write on right underneath here. For example, you have an order that says, I don't know, Lorazepam, and it's
Okay, here it is.
the doctor orders 500 milligrams per kilogram. That's the doctor's order, and the doctor says, I don't know, Q 24 hours, right? That's the order. And then you have a kid that weighs 10, how many pounds is it? 10 times 2.2. Let's say we have a kid that weighs 22 pounds. That's what the kid weighs, right?
Mhm.
So on my problem, I have to first what I'm looking for is how many milligrams I'm gonna give the kid. So if I'm gonna give milligrams, so first I have to put down the 22. I have to put the 22 pounds, and then put my conversion factor here, which is 2.2 pounds. It's equal to 1 kilo, right? And then the doctor's order says, oh, you guys, I'm sorry, hear my voice screaming. It's a 50 milligrams per kilogram, right?
I did it so backwards.
Who did it backwards? Me?
Me. Now
Normally,
that I remember.
you always want to start with the weight. You always want to start with the weight. That way, you get that out of the way, and then you get the actual order. So right here, I cancel out, and then I'm left with my milligrams. So when you multiply, there's students that they convert this first. They convert it, but I don't recommend that because it's not always going to be a round number. So sometimes you get a kid that weighs 15.32 kilos or something like that. And then you round it down, and then you do miss some milligrams on the way if you do it separately. So I always recommend to work it out all across, to work out the problem all across, like 22 times 1 times 50.
So always do the weight first and then do the medical conversion.
Yeah, I
Okay.
would do it like that. That way you always have that same setup and you're not gonna miss any conversions there. So when you multiply that, then you put the 50 times 2.2. And then I have one decimal point, right? I know that's 22. So, and then you're gonna divide that over 2.2. And that'll give you, you know, the how many milligrams the kid needs to get any dose. Okay, so but normally it's just this, the weight, adding the weight is part of the conversion. It's part of the conversion factors. That's why maybe we haven't done one of those.
Yeah, so what I did, I don't know if it's backwards, maybe. So I found the problem. So it was 15 milligrams every 12 hours for a child weighing 10 kilograms. So I multiplied the 15 times 10
Mhm.
and then worked the problem.
Yes, that's all. That's what it is. Mhm.
Okay.
And then so that's one type. And then I can think of another example where you like say it again. What was it? The child was 10 kilos.
15 milligrams per kilogram every 12 hours for a child weighing 10 kilograms. And the dosage strength is 250 milligrams for every 5 milliliters.
And the kid was 10 kilos. And what was the question? What was it asking for?
How many milliliters should the nurse administer?
Okay, so if the dosage strength in there, it's kind of like a distractor. Because all it's asking you is how many milligrams. If it was asking you for mLs, because you do have a dosage strength, right? What is it?
250 milligrams per 5 ml.
Uh-huh. So I mean, I'm not reading the question exactly, but from what you're saying, if the question was how many mLs will the nurse administer, then you will plot this into the problem. But
But it would
since
be
it's
the
not,
weight first.
since
Okay, so
since it's not asking you for mLs, it's only asking for how many milligrams will the nurse administer.
I'm sorry. Yes. How many milliliters of the medication?
Okay. Yeah.
So in this case, because it's already in kilograms, there's nothing in regards to the weight that
Yeah.
actually needs to be converted. We just need to like work the problem.
You just
But
need
if
to work
it's
the
in
problem.
pounds, then we need to convert the pounds.
You would have
Okay.
to convert the pounds and add them. All you have to do is add them like you know, like the 2.2 divided by you would have to add that conversion into that. But this one, just by looking at it, it's like you have the 10 kilos.
okay, 10 kilograms
And then you have
times the dosage, right?
it says
Okay, so
50,
it's 5 ml,
and then you have the
250 milligrams.
and then remember what I told you, that in the dosage strength, the strength goes in the bottom, and then the unit of measurement goes in the top. And then you could cancel out here.
Oh shoot, I did it backwards. Okay.
And that, and then this is what I'm looking for. So this is what it would be, the mLs. And if we didn't have 10 kilograms, if we would have just had the 22 pounds, it would have had to be like this.
And we have to add the conversion as well?
What do you mean add?
Oh no, I'm sorry. Yeah, the 10 kilogram, the weight cancels off with the bottom, right? Okay.
It cancels out. Yeah.
I'm sorry. It's just I need to see the process.
It's right there. Okay. Oh, I'm sorry. So remember that right here we have that imaginary one. So they're opposite, kilograms.
Weight first, then dosage required. Okay, and then it's 5 mLs. Cancel out. Okay.
So you wouldn't necessarily be asked, like, you have 100 milligrams per ml or per tablet of a medication, and you have a patient who weighs 20 kilograms. You have to know, you have to have an ordered strength in
Yes.
order to be like, you're not going to be asked to figure out, you have to have an ordered strength to figure out what you need to do.
Yes, you
Okay.
do. You will, unless, like, if all I'm asking you is for what's the dosage, if I'm
Uh-huh.
asking you for the dosage, then you probably don't need a dosage strength, because I'm just asking you how many milligrams would you administer of a medication.
Got
If I tell you this is like, I don't know, 50 milligrams per kilogram, and the kid weighs this much, you need to come up with what's the dosage. Once
Got
you come out with the dosage, and then we give you the supply, we give you like the supply with the dosage strength, then you have to figure out how many mLs, based on that dosage strength would you give. That's what makes the problems really long sometimes, because we have to work the whole thing. And then sometimes it's even a little bit more spicier, than that. Instead of doing that, we go every 8 hours. So you're like, oh, no, hold on. Let me just put it. There are some medications that are actually written like this. So like this, the order is written like this: 50 milligrams per kilogram per day, but the doctor wants you to give it in divided doses of 3, in 3 divided doses, for example, in 3 divided doses. So I'm gonna do the problem, it's gonna be per day, but the doctor wants me to give it in 3 divided doses. So, and my question is, what will the dose be? How much would you give to the patient in one dose? So then you have to add that here into your conversion, that it's milligram per kilogram per day. And then you have to put 1 day here, and then 3 doses. So that's something else that you add to the conversion table.
Got it.
So that you're like, okay, now I'm gonna cancel out day, and my answer is going to be, or it's already here, look at divided by 3. So whatever my result is gonna be divided by 3, and that's gonna be my divided dose. So it's, and it's not us making it harder. That's, how the medications inserts, it looks like that, like it tells you, the most common antibiotic that I can tell you is the Rocephin. The dosage is 50 milligrams per kilogram, and per day. So sometimes the doctors order them twice a day, once a day, or every 8 hours. So we have to work it out to divide it into those doses.
Got it.
So that's another thing that will make it a little longer. And then, there's more things that I can add to this. Like if
We
you
had
take-
one like that on this test, I think,
Mhm.
where it was like a tiny little number.
Yeah.
It was like how many tablets, and I think it was like, I don't know, the answer was like, what was the primary healthcare provider has ordered alprazolam 0.25 milligrams twice a day. The pharmacy sends alprazolam, which has the dosage strength of 2 milligrams per tablet. How many tablets should the nurse administer each day? So it's like, figure out how much per dose,
Mhm.
and then times 2. So it was like it was like the tiniest. It was so hard.
It was hard. It makes it hard. In alprazolam, it's a sedative. It's a sedative medication. So we do use it, like we have to be really, really careful. And the dosages are like 1 milligram, 2 milligrams. And we have to like give sometimes a little piece to the patient only because of the strength of the potency of the medication. So anyway, so can I go to the well, we didn't
Yes.
work this one out. So it said 1 liter. What is the rate? So by saying the rate, remember, this is what I'm looking for. Rate pump, then this is what I'm looking for. So it says 1 liter. And I know you guys know already that 1 liter is 1,000 mLs.
Yes.
You could just plug that in there right away without having to, but let's work it out like this. 1 liter over 12 hours, right? So what you can do, it's like put your conversion table and then one así, right? But 1 liter, we already know it's 1,000, so you can just go ahead and put the 12 hours like that. Or you can add it, you know, you can add in the conversion table, which is gonna come out to the same if you look. So mLs per hour, that's what I'm looking for. We don't need to add anything else to our conversion here. So 1,000 over 12, it was 83 mLs per hour, per hour. So that will be my answer. Okay, let's work another one.
It is. So nice. It's 20, 20. Jennifer, how did you apply it?
You guys figure it out.
What was that, Jennifer?
You guys,
Then
what do you,
how did you apply it?
how to what?
How did you set it up?
Oh, so we got rate and pump, right? So we know, what are we looking for, Jennifer?
Milliliters per hour.
Right, milliliter per hour. And the order says 20 milligrams of famotidine in 50 milliliters. In
Okay.
50 milliliters of normal saline, the gen lift. So 50 milliliters of normal saline, they need to be infused over 30 minutes.
Okay, got that.
Over 30 minutes, right? So in reality here, the milligrams, they don't really, because all what we're trying to figure out is the rate, not the dosage. So we're trying to figure out the rate. So we're trying to get this. So what do we need to add here? I need to convert them into mLs per hour.
Hours,
I need to add, right? I need to add, how would I add
1
it?
hour,
That's 1
or 60
hour over
minutes.
20.
I put it wrong. I put it in the wrong
Oh.
place.
60
So where
minutes
would that,
equal to 1 hour.
So how many minutes in 1 hour? 60. And then 1 hour. So by doing this in that way, that you know, we need to know the conversion factors. That way we know how to convert this into mLs per hour. So now I can cancel out, I can get rid of the minutes and be left with mLs per hour. Right? So 50 times 60. So I got.
So you don't need to worry so much about the medication that was ordered.
Mhm.
Okay,
I-
that's threw me off.
So that's a distractor, you guys. That's it is kind of like a distractor. I don't need it because what I'm trying to figure out is the mLs per hour. And a lot has to do with what's asking you. If I was kind of asking you what's the dosage or how many milliliters per minute, or is it going to be how many milligrams per minute is it going to be infused, then I'm already adding I would be adding this, right? If I was asking you how many milligrams per minute is it going to be infused, what I would have to do is just, you know, divide the milligrams in the 30 minutes. But that's not what I'm asking. What I'm asking is the rate on the pump. So we have to be careful when we read what's it asking us. So I can cancel 1 0 top and 1 0 bottom. And then I'm left with 300 over 3, which is going to be 100. I know that might be confusing, but the more we work on them, the easier they will get. Okay. Can I move on to the next one?
Yes.
Sarah, I'm gonna call Jen,
Yes.
and Jennifer Rascon.
Yes.
Okay, I'm gonna go to the next one, okay?
Alrighty.
We're too many gents. Just call me Jessie. My second name is Jessie.
Oh, really?
Yeah. My mom was very Mexican.
Watch mine. Luz del Carmen.
Jennifer de Jesus. I was like, Mom, how do you mix a
Okay.
white girl name with the most Mexican name?
I know it's a big issue to have the conjunction, the del, because they always think that's my middle name. It's crazy. Anyway, so I give my kids one name. Well, a couple of them have two, but so let's see this one. So again, rate, pump. So I know it's mLs per hour. And the order here says 500 milligrams of D5 and normal saline over 6 hours. And it's asking me how many mLs per minute. So I have 500 mLs over 6 hours. So I already have it there.
So 500 for 6. I hate zeros.
Oh, it looks like it's gonna be 3.33333. So what is my answer there? How would you write it?
83 mLs per hour. So this one was easy because it was already milliliters per hour. So when it's per minute, you need the additional conversion of 60 minutes over hour.
Yep.
Okay.
So 60, 6 times 6. So if I would have said over, and normally you'll see some medications are over 15 minutes or over 30 minutes. So then you have to convert that into hours. Then you have to add the 1 hour over 60 into your, so that you can break down the minutes and you can cancel out the minutes and convert it in hours. And then you'll see, then you'll come up with the, because you have to make it in mLs per hour in the pump. Okay. So we're good with the drip rate?
Yes, I think.
Okay. So now let's talk about the doing by drops, the drop factor. So this is the key word, the drop factor or drop rate that we use as well. So this is to figure out by gravity, how we're gonna infuse the medication by gravity. So we have two different types, two different ways of doing it. There's two different types of secondary IV lines or in tubings, two types. There is macros and there is micros. So the macros, as you can see here, this is a big drop. It's a macro. So the infusion is gonna be with these big drops. There are 3 different types of macro drip sets. So it could be a 10. So that means 10 drops, 10 big drops per milliliter. So every 10 drops is an ml. Every 15 drops is an ml, or every 20 drops is an ml. Okay, so we have different ones, and because depending on the medication, some are really thick. The best example to give you is blood. When we have to give blood to patients, we have to do it in a macro tubing set, because, and it has to be on a 10. That's like a standardized 10, because the smaller the drop, the more cells that will die. So they want to infuse it, you know, as complete as possible. So they, for blood transfusions, we always use a 10. So depending on the medication, and there are other ones that are micro drip sets, and that means that they're 60 drops per milliliter. So they're super tiny. So the micro, the good thing is that the micro, they're pretty, that's it, 60 drops per ml. It's pretty standard. This is something that you guys will find in the tube, in the wrapping of the tubing. When you see the tubing, it says there the drip rate. It will tell you like how many drops per ml. So it's important that you read that and that you know that. That way, you know, you don't look at a big, it's a huge difference, 20 to 60 drops per ml. So it's a lot. Okay, so that's the 2 different types of sets that we have for drops. And in order to calculate the drops per minute, it's again utilizing the dimensional analysis. Is the same, only that we are going to, when we set it up, we're gonna set up the total, like for example, you have to give 1,000 milliliters, and this is the tubing that you have. This is the drop factor. So it's the same, the drops, only that the drops go in the top and the mLs go in the bottom. And I'll show you right now, right here. So the total amount, the total mLs, and then you add the drop factor, which is GTTs. That's another way of writing drops, you guys. GTTs, drop per ml, okay? So let me show you.
So the macro, the drops are bigger?
The macros, yes, the drops are bigger. They're 10, 15, or 20. So when I put in the problems, if I tell you, if in one of my problems I tell you macro, just macro alone, and I don't specify which of the 3, you should know that the 15 is the one that you're gonna go with.
That's the standard.
That's the standard.
That's the standard. Yes, ma'am. That's the standard. 15 is the standard. And 10, if I say blood, you're gonna transfuse blood on this fulanito patient, you should know that 10 is the standard. 10 is the standard, and then for blood, unless the doctor says otherwise. And then 15 will be my standard for the macro, if I don't specify, okay? But in some of my problems, I do put, you know, like you're gonna do it by 20 or 15, but if I don't, just so you know, it should be 15. And the micro, you only have 60 to work with. Okay, so let me tell you how I work it out using the dimensional analysis. So you have that problem right there, and it says the physician orders an IV to infuse at 125 mLs per hour. And the nurse has an IV tubing with a drop factor of 15 drops per milliliter. It's asking me what's the flow rate of the IV. So it's asking me how many drops per minute, would I give on my patient. So I'm looking for this. I wrote ml. So usually that's what I'm looking for when we bring the drops to the equation, okay? So it would always, it will be drops per minute. So you guys, I don't know if you guys are working it out already, but. And the drop factor says 15 per ml. So you will put the 15 on the top, ml goes in the bottom, and then it needs to be by per minute. So I have to, right now, if I cancel out this, I'm not able to. I still have to get rid of the hour, right? So I have to put 1 hour, 60. So now I can cancel hour, and now I'm finally left with GTTs per minute. So if I multiply 125 over 15, I got 1,875 over 60, because this is 1 times 1 times 60, so it's 60. So now over 60. So 60 over 187, 6, 12, 18. So I got 3.
These don't have to be in whole numbers?
They have to be whole numbers too.
Okay, so we would not include the 0.25?
There is no point. Exactly. Thank you. So there's really, at this point, I ended up at 31. And I do want to go to the first decimal, because if right here is at 31.2, right? So
Yeah.
I will stay at 31 drops.
So if that was like a 6, would that be 32?
Exactly. So if it was a 0.6, then I will go to a 32, unless it's a pediatric patient. If it's a pediatric patient, you round down, you don't round up. That's the only exception on PEDS patients. So right here, I have 31 drops per minute. How's everybody doing? Jennifer's like, did you say something?
No, just pulling my hair out.
Ms. Bravo, so every time we have drops, is it safe to say the drops are measured in minutes, right?
Yes, drops. It will be drops per minute.
So if we
Because-
see that in the problem, like what is the drop factor, then we automatically know it's
Yeah, it
drops
would
per
always be
minute.
drops. Yes. And then we have to think, on my last final, I had a student that came up with with the, we will never give you problems that are unrealistic. So if all the problems that we'll give you, they have to be realistic. So right here, can you count 31 drops in a minute? Yes, you can, right? You will be like
Yes.
counting.
Mhm.
One of the students had an answer that had 200 or 2,000 drops per minute. And I was like, okay, that's when I'm concerned and I'm worried because I'm like, there is no possible way that you can count 2,000 up to 2,000 or even 200 drops in a minute because it's just too many, right? There, it's not realistic. So then you're like, you know what, there's something wrong with my problem, or there's something wrong here. Then that's what we want you guys to be able to catch, that you know, it has to be something that is realistic.
Right.
Okay. So going to the next portion of this presentation, figuring out the infusion and completion time. So that's something else that you'll see that doctors do, that they tell you, they might tell you, give this 2,000 mLs over 8 hours. You have to figure out when the completion time will be. How long is it going to take for this infusion to be completed completely? Or they give you, they might give you the order differently, like infuse at 125 mLs an hour. Then you can figure out how many mLs will be actually infused over that period of time. So things like that. So as we're taking care of patients, we have to be considering the different types of orders that we're going to get. And then an example would be like, sometimes the doctors just renew the orders and they're ongoing and ongoing. And we're like, wait a minute, the patient can go into fluid overload. Remember that we are the nurses, we're the ones that are with the patients the whole 12 hours. And sometimes the doctors don't realize, and they come in and they renew the order again. So, and we are the ones that we have to be vigilant. And we're like, you know what, doctor, this has been going on for, you know, so long. And then they're like, oh no, stop it, you know, stop it right now. So there's multiple reasons why I can tell you that we have to be constantly vigilant of this infusion times, or how long does it take for this medications or infusions to be completed. So when we figure out completion times, we normally go, we always utilize military times. I don't know how are you guys with military times, but everything is in military time. And the reason for that is because the 2 points, you know, and when we're using the regular, I guess, time, that can lead to error. So if we do military time, there is really less chances of error when we're writing down. And that's, you know, that's one of the most important reasons. Okay, so okay. Let me see. That order says an IV order may be written so that, oh, that it was a problem. I just told you this, like you might get an order that it says infuse the 1 liter every 8 hours, or you might get an order. This is just telling you give this over this period of time, or you might get an order that says start 1 liter at 125 mLs per hour, and then we have to like figure out how long is it going to take for that infusion time to be over. So in order for us to figure this out, there's different ways as well to do it, utilizing the dimensional analysis. So to calculate infusion time using dimensional analysis, this is one example, which is what we started off today. Like if they give us an order to infuse 1,000 milliliters and to give it over, and this one, if you look at the example here, it is telling me the order amount and it's giving me the rate. So milliliters per hour. So in order for me to calculate the infusion time, I just have to divide them, right? Divide the 1,000 over 125, and my infusion time is going to be 8 hours. So that's what I mean by saying infusion time. calculating the infusion time. How long is it gonna take for this infusion to be over? Okay, so everybody clear on that? So to calculate the infusion time, we just have to do this, the divide the order amount by the conversion factor, by the 125, and then we'll get how many hours or how many minutes before it's completed. Okay, how about you guys work that one for me? And remember, by infusion time, so if I'm trying to calculate the infusion time, what I'm trying to figure out, how many hours is it gonna take for that to be completed? Oh, should have put it right here. So 50 divided by 5. So that will be my answer. You guys okay?
Yes.
So right here we have another practice. It says start 1000. And it says, this is the order to start the 1 liter at 100 mLs per hour. And this setup will always be the same. If you started with the mLs, remember that's the top. So you for sure have to have the mLs in the bottom and then the 1 hour. So it's asking me the infusion time. Cancel, cancel. So I can get rid of 2 zeros. I can get rid of 2 zeros. 10 divided by 1. It's 10 hours again. So in 10 hours would be will be completed. So this will be like the perfect, it will be perfect if all the infusions were given like this, they will be like round like this, so cool. But sometimes we do get 10.5, 10 point something, and we have to convert those into minutes. So that's when we might end up with a decimal. We might end up with a decimal. And this is an example right here, like it says the decimal fraction represents an hour. So we have an example here, an order that says 1,000 milliliters to infuse 1,000 milliliters. And then it says, the doctor says at 80 milliliters per hour, right? So it's asking me what's the infusion time. So if I divide 100 over, yeah, let's say, I know. So if I have 100 over, well, that's how we work it out, right? 1,000, I'm sorry. And then it's 100 over 8. The answer is going to be 12.5. So if I have 12.5, I know 12 hours already for sure, right? But to convert the half, the 0.5, I have to convert it into minutes. So the bottom, this bottom, this is about how you will set it up to convert that remaining that remaining hour into minutes. So it's 1 hour, 60 minutes. So, and I mean, we know that 0.5 is half an hour, it's 30 minutes, but sometimes we do have the 0.3, the 0.4, the 0.8, and it's really like, oh, you have to convert those. So that's how you would convert it, you guys. So 0.5 times 60 is going to be 30, and then that will be 30 minutes. So my answer there would actually be 12 hours and 30 minutes. For that infusion to be completed. You guys follow me? So let's do this one. So my order is 1,000. The 1 hour. So cancel hour. And then I'm going to pull a decimal here. So it's going to be 0. Is that an 8? No, it's another 6. So I got 6.6. So it seems it's going to keep on going like that, 6.6. So I want to get that. So I know for sure 6 hours. And now I have to convert the 0.66 into minutes. So what I would do, it's point. So it's 39. So I would put a 40 there because you see that it's 39.6. So I will go to 40. So it is 39.6. So I'm gonna go to 40 minutes. So my answer is gonna be 6 hours and 40 minutes. You guys follow me there? It's okay if it's no, we can.
When you multiply the bottom, the minutes and the hours, the 0.66, do you want to do 2 decimal?
If you go to decimals,
Places.
if you go to decimals, you're going to be more precise.
Uh-huh. Okay.
And not all the times you go up to 2 decimals. Sometimes you just like stay at
Have
1.
one. Okay.
We're ready. I'm gonna go to the next. And then we have, okay, now to figure out completion time. So we just figure out the infusion time. What is the infusion time? How many hours is it gonna take for this to be over, for this infusion to be over? So now let's talk about the completion time. So completion time refers to when is it gonna be over? You know, like by if we're talking in hours. And like this is where I told you guys that we use military times. Military time, so it's more convenient. There's less chances of errors, eliminates that colon, and then we are always going to do military times in 4 digits, even if it's midnight 0000. That's how you write it down. That's how we identify and we eliminate the AM and PM just by using military time. And I personally have my car, my watches, everything in my, I mean, everything's military time in my house, even my everything. Okay, Sarah. So the military time, let me see. So like I said, we go on 4 digits, and it just tells us the whole 24 hours a day. This is an example right here. Instead of 12:30 p.m., we just do 12:30. So this is how we calculate completion time utilizing the military time. So what we do, it's like, if my doctor says this order, 1 liter of D5W was started at 10 o'clock. So if it was already started at 10 o'clock in the morning, right? On the patient, and it's to go to over 10 hours. So it was started at 10 o'clock and it's supposed to be going over the next 10 hours. What we need to come up with the completion time. When would the completion time would be for that? So normally this is how we set it up. Start time is 10 of 10 military time, and the infusion time is in 10 hours. So 10 hours, we're gonna put the 10 and the 2 zeros, and then we add them up, and it's gonna be 2000. So this is 8 o'clock. That's the completion time right there. So that's how we figure out the completion time, by adding it like that. This is another example. This is a medication, 1 liter again. It was started at 8:30 on the patient, and it's to be going at 100 mLs per hour. And it's asking me when would it be completed? So let me give you a couple of minutes there so we can figure it out. So if it's 1 liter, well, I'm gonna just by looking, if it's 1 liter, I know it's 1,000 milliliters, right? So that's the total volume that should be going over in 100 mLs per hour. So I already know that this is going to be going in how many hours should be completed. So if my total 10 hours, right? Because I have to do 1 liter, which is 1,000 milliliters, and it's going at 100 mLs per hour. So it's going at 100. I can also set it up like, well, you can do the setup to come up with the 10 hours as we have been working it, like 1 per hour. So it's going to be 1,000 over 100. I can get rid of those, which is going to be 10 hours. So I already know it's going to be 10 hours. So what I have to do is now add up the start time. So my question is, what is the completion time? So my start time was at 8:30. So now I have to add the 10 hours. So that gives me 18:30 for my completion time. Right? So what is 18:30? What time of the day is that?
5:30? No, 6, 13, 14, 15, 16.
6:30.
Yeah, 6:30, my bad.
Yeah. And it's start time 8:30, 8, 9, 10, 11, 12, 13, 14, 15, 16.
13, 14, 15, 16, 17.
So yep,
18,
10 hours.
6:30.
6:30. So that's how we figure out the completion time. So let's do this one. So first I want to figure out how many hours is it going to take, right? First I want to know how many hours is it going to take for that 1 liter to infuse. I think we had already done one of over 50. It was a 6.66666. So I know for sure it's going to be 6 hours. And now to convert that 0.66 into minutes, I think it was 40. I think it was 40 earlier. It was the 40 minutes. So I got 6 hours and 40 minutes. So I got that. Now I need to figure out the completion time. So at this time is when it started. So I'm going to add, right? And then I have to add 640 because this is the time where it started, plus the completion, you know, plus the infusion time, which is going to be 640. So my infusion will be done at 9:55 or 21:55 using military time. Híjole, are you guys okay?
In the test, are you gonna want us to do both the military and standard, or you're just gonna want the military time?
It's just military, just military. So I'm right now I just told you how to convert it into military time.
Mhm. So it's per hour. You start with the limiter starts 1,000 milliliters. LR. And then this
How are you guys doing?
I think I'm okay. I don't know yet.
Yeah, it makes sense right now, but later you're like, get a screenshot, get a picture of the. So that's how we figure out the completion times and infusion times, you guys. So
it's a two-part. So it's not just, so you figure out how long it's going to take for the entire order to complete, which would be 6 hours and 40 minutes.
yeah,
Then you add that to the time that you started, and then that's the time that you should be completed.
yes.
So
yes,
it's all you're asking for when we're talking completion time, we're figuring out how long,
at
and
what
then
time?
so it's always two parts.
Yes. Yeah. Infusion time, it's how many hours is it going to take for that? How many hours is it going to take for this to be completed? And completion time, I'm asking for an actual time. Like, and if I'm asking you for completion time, I'm also giving you a start time. I have to, in the problem, you will see that in the problem, it's telling you this medication got started at such and such time. When would the completion time would be? And then we would have to like figure out an actual time.
So the D5W, for example, one of the ones that we did where it was 1 liter of dextrose 5, like the actual like in numbers involved in the D5W, we don't worry about that. It's just the liter,
Worry
the
about
start
that.
time, the milliliters per hour, and then focus on if it's asking infusion or completion or both.
Yes, ma'am.
Got it.
Yeah, that's what we have to worry about. And then infusion times, I mean the solution, the type of solution, that's another story. But like I said, it's like we have to see the type of cells, and I mean what's the purpose of the solution and all of that. That's something that will be more when you guys are in the program, but there is still a little bit, always there's a little bit more to it. But it becomes really interesting once you get the hang of it. And then you see, oh, I should not be giving this fluid to this patient because, you know, it's going to cause this. And so, but for the most part, everything we use is normal saline, the 0.9 normal saline, because that's an isotonic. It does not impact the cell. It just replaces fluid. That's all it does. So, but you don't have to know that, Jen. Just the infusion time, completion times, and then But on this slide, you guys, this slide, it just, you know, tells you, gives you an idea. So, you know, if the doctor's giving you an order with a solution, you have to like verify and see the type of solution that you have on your bags. This is a sample of a 1 liter bag, and this is a sample of a half a liter bag, which is 500 mLs, 1000 mLs. And those are the ones that we use most commonly in the working at the hospital, and even outside the hospital, you'll see those too. The line markings, this is just quickly, briefly telling you like the markings. You will see that there's some bags that are marked in hundreds. So you will see that it's actually going down backwards. Like you start off with 1000 and then 900 and then 800, 700 until it's round out. But all the bags have line markings, and you will see the line. They will be anywhere from 50 to 100, you know, every line. That's what it basically would mean. Sometimes they're in hundreds. So again, it gives you an idea of the line markings. Every line in here, it's 100. Okay, so and then to monitor the infusion, like I said, it would give us, that's how we get an idea of how when we monitor our patients is in milliliters per hour. We have to be very vigilant on this, like I said, because we are the ones that are constantly seeing the patients. Okay. So another example, and I bring a lot of examples sometimes because our students learn by experience. So you guys learn by our experiences. This is not my actual experience, but I remember this pediatric patient that we got admitted into the floor because in the OR, they kept on hanging fluids and fluids and fluids. I think they hang like 4 liters of fluids on the little one. And he had this fluid overload. He ended up admitted for pneumonia due to fluid overload, because they just kept on hanging and hanging and hanging IVs, and the completion time, you know, they missed it, and they just kept on doing it over and over, causing a fluid overload to the patient. So it can be very, very, it's a big deal. So this slide, it just gives you a sample of how we used to, these were adhesive, and we used to put them on the bags. And every line, like I said, it tells you like if you start the IV at this time, at this rate, when would it be done and finished. So there's some of this type of flow meters that we use, that we've used before. And to be honest with you, I'm not gonna test you on this because this is kind of like a little bit older, but I do still want you guys to be aware of it. I haven't gone this even in home health, and we get the older stuff sometimes in home health, but they're actually pretty cool because it gives you already an idea. Like if you have to administer medication, a specific flow rate, it tells you when is it going to be done. It's already like pre-math for you. So it gives you like the infusion times, and you start marking it depending on the number of hours that it needs, the medication or the infusion needs to go. That's basically what those flow meters are for. And that's it, you guys. This was probably like the longest presentation of the whole entire class, I think. Híjole, you guys are okay?
Yeah, I'm okay.
Yeah.
I'll probably re-listen to this one, but I think I'm okay.
Yeah, that was 13. Let me see. It's 11 o'clock. Oh my goodness. If you guys have to go, we can go over your questions that you had from the previous lecture, and I can continue recording. It's up to you.
I'm okay right now. I can stay if you're going to continue.
Okay. We have another, oh, Jennifer. Me, okay, this is just cool. Okay. This is the other chapter. This is not as big, you guys. This is chapter 13, 14. This chapter is about administering direct IV meds. Okay, direct IV meds. I don't know if you guys have ever heard direct IV push. That's what I mean, the IV push medication. So they're normally injected directly into the vein. You don't need to mix it up with in a bag or anything. It's an IV push medication. So they go directly, and the purpose of this direct IV medications is because we want them to start working immediately. Okay, that doesn't mean that we have to, like, some of them need to be pushed right away. Some of them need to be pushed over a period of two minutes, 1 minute, 3 minutes, depending on the purpose of the medication. So that is something that you will find on the drug label for sure. So in your terminology, so you see what's the difference in between a direct IV or an IV infusion. So we just went over IV infusions. We talked about continuous, it's ongoing, intermittent, the piggybacks that are intermittent. And then we have the direct IVs, which would include, when we inject it directly right into the port, the heplock, we call it the heplock, right into the IV, and it goes directly in. It could be, if it's going in the infusion, we kind of like clump the other IV and we push, it just directly goes into the vein. The IV push or IV bolus. An IV bolus is also considered a direct IV because we rapidly administer it on the patient. Or a bolus injection, that means that you connect it and you push it right away. There's a couple of medications that we have to push in, the faster, the better they work. But most medications are slow IV push. Okay, so when we do IV push medications, we have to see the label for always, because we have to see if that medication needs to be diluted, or and also the rate of the administration. Like I said, how long do I have to push this medication? One example of dilution would be I don't know, morphine or Diluted. Diluted is a pain medication and it's really strong. I always dilute Diluted in normal saline, because if I push it just like that, I'm not kidding you, when they push it in, you feel this heat going from top to bottom all the way. So you have to dilute it and push it slowly, because the patient can pass out on you, the patient can throw up
I'm
on
gonna
you.
say you feel like passing out.
It feels horrendous. And there are nurses out there, I had that happen to me, that I had a horrible migraine, and Diluted, you don't want to give me Diluted because I get very silly, very goofy, I salivate. Oh no, you don't want to see me with, if you're a nurse out there, you don't like me, give me Diluted and you're gonna make fun of me. And I always tell people, don't give me Diluted, and I always tell my husband, and he didn't see, and I had a horrible migraine, and I was just like this. When I opened my eyes, the nurse had already pushed the medication. She didn't even tell me, I'm gonna give you this, what's your name, all that stuff. She didn't even see my face. She didn't know who I was. Not that I'm important or anything, but I worked there, so she didn't even see my face. She pushed the Diluted, and I was like, oh, what did you just push? And she was like, Diluted. And I was like, no, and I saw the little syringe, and I knew that she didn't dilute it. I was like, you didn't dilute it? And then at the moment I said that, the heat, it was like, I felt it going through my body. It was horrible. It's like I converted into something else. And it's horrendous. So there are some patients that they're pain tolerant, the pain medication tolerant, and you can give them and push that medication and nothing happens to them. There's patients that might fall on you, they throw up on you, it's really strong. Diluted is like 10 times stronger than morphine. So it's horrible. Sofran is another one, the medication for nausea and vomiting. Sofran, you always want to push it over 2 minutes. If you don't push it over 2 minutes, the patient, it's funny and it's ironic, but the patient might throw up on you, because you're giving them Sofran for vomiting, and then they can also get really dizzy and pass out on you, but they can also, throw up, or their blood pressure their blood pressure just drops. So you want to be nice and careful with that as well. So we need to know the instructions for sure, you guys, and be always vigilant of that. Go
Is
ahead.
dilution of like Dilaudid, Zofran, those things, is that at your discretion? Like, can you like recognize, I'm sure as you go through pharmacology, you get to see like, okay, this can have this reaction, but is that one of those things where like you see, okay, this patient is gonna get Dilaudid, I should dilute it? Or does it come with those instructions where
It comes with instructions and it says that you can that you need to dilute it with normal saline. I am not sure if you can give it, but slowly, don't just push
Got
it
it.
like. And also if you have an ongoing, sometimes you have an ongoing IV going infusing, and if you're pushing it, you probably don't have to dilute it because it's already fluid, it's already coming in, and you kind of it mixes up there. So yeah, sometimes it's at our discretion. And there are other medications that you do need to dilute with other things. Another example is Protonix. Protonix is an anti-acid, anti-ulcer medication. You don't want to give Protonix just raw like that. You have to dilute it in 20 mLs of normal saline. That's what the literature is going to say. And I still see nurses, that they use less to dilute and things like that. But that it can harm the patient because sometimes the medication is really strong. If you just put it like that, it can burn the vein. It can burn the vein. It can be very painful as well. It could cause cramping. It could cause, like the pain. And we want to be very considerate of our patients. Or sometimes they're real sick and they just like push it. So you guys don't want to do that. But yeah, always look at the literature and see what is really asking you to do. Some medications don't need to be diluted, and depending, there are 4 types of instructions for medications that you have to do. If the medication needs to be diluted, you have to check what's the specific amount of the diluted or the dilution or fluid that you need to use. Is it sterile water? Is it normal saline? Might be with lidocaine, something. What is it that you need to dilute? And then there's some dilutions that they need the equal amount of the drug and that diluent. In other words, if you need 2 milliliters of the medication, you need to dilute it with 2 milliliters of normal saline, the equal volume. Some dilution is also based on diagnosis, age, and weight. So the elderly population and the pediatric population, they always have specific instructions that you can follow. And then if you want to achieve a specific concentration on the medication. So it depends on the instructions. You see a sample here says, like I told you, always check the drug literature and see what it's telling you to do. And for the most part, you don't need to do any calculations when you have to dilute. You just have to read, like it says, dilute medication with 5 mLs of sterile water for injection. So that's the diluent, and it's going to say right there in the literature. So all you need to do is, add the 5 milliliters of diluent added to the amount of medication. Okay, so in this specific example, it's telling you the ordered dose is 0.2 milligrams contained in 1 milliliter, right? So and then the diluent, it says 5 milliliters of sterile water, right? So let me go back. This is when it's a specific volume of diluent. Okay, that's one of the 4 instructions. The specific volume is telling you right there. The other, it's equal volume of drug and diluent. So that's the one where I told you that if the order is 1 milliliter, like right here, the order is the same, 0.2 milligrams in 1 ml. So you have to add 1 ml, an equal amount or an equal volume of diluent to the, 1, so that it can be 1 and 1. So the diluent instructions here says dilute medication with equal amount of sterile water. So you have to add 1 milliliter of sterile water or diluent to the 1 milliliter of medication. Okay, so that's basically what it is. You don't need to do calculation for that as well. And then we have the dilution based on diagnosis, age, or weight. So, and it will tell you there in the literature if for children or adults that weigh less than blah, 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 in this case is 40 kilograms, it's telling you to dilute 0.1 milligram in 10 milliliters of sterile water. So it's like, you might need to calculate that. In some cases you do, in some cases you don't. For example, here, again, it's the same, we're just using the same order, 0.2 milligrams in 1 ml. So it's telling you, and the patient weighs 38 kilos. So it does apply to this patient because it's less than 40 kilograms. So we have to dilute every 0.1 milligram in 10 milliliters of sterile water. So in here we have 0.2, right, that we have to give. So if you see the chart here, 0.1, so 10 milliliters, 0.1, another 10 milliliters. So in this order, you would use 20 milliliters of sterile water to dilute that medication, right? Did I explain myself? Did I explain you guys correctly? So my patient weighs less than 40. I have to dilute every 0.1 milligram in 10 milliliters of water. So since the medication is 0.2, so every 0.1 is 10 mLs, every 0.1, 10 mLs, 0.1, 10 mLs. So I need to dilute 20 milliliters of sterile water for that medication. Okay. So the other is dilution is to be able to achieve a specific concentration. So again, the order is the same, and it's in the IV administration says dilute to a concentration of 0.1 milligrams per 2 milliliters of fluid. So in this case, it tells you you have to add, fluid. You have to add it so that is 0.12. So just by looking at it, if my order is 0.2, I have to add 2 milliliters. This is how you would set it up. The order is here, 0.2, and the concentration is 0.2 milliliters per each, 2 milliliters per each 0.1. So that's gonna be equal to 4, right? That's gonna be equal to 4, and and we already know that there's 1 milliliter of the medication. So this will be my diluent, 3 milliliters. You guys follow me there?
Yes.
Right? So I just have to add diluent. I have to add the diluent so that it can be to what it's telling me here. For every 0.1, I have to have 2 mLs of fluid. So it's going to be, when I work it out, it's going to be to 3 mLs. It's too thick. And that's how you would set it up to come up with the 4 milliliters for the whole, for the order. Okay, let's do this problem. So the order is telling me to give 48 milligrams direct IV every 12 hours. And that is in 2 milliliters. So when you read it, you're like, the flojera, right? Because you're like, but you see that it says the nurse, this is the order. She needs to administer this much. And the dose is contained in 2 milliliters. So, and then it says the dilution instruction that I have here is to be diluted with normal saline to be able to make a concentration of 12 milligrams per 1 ml. So when it's asking me how much diluent would the nurse add so that medication can be ordered. I'll let you work it out. I'll work it out here on my paper. So you guys got it?
No.
And there's two ways. It's okay. I should have put another, let me put another slide here to work it out. So my order says 48 milligrams, right? And that is every 12 hours. That's okay.
Is
So you,
two. I think where I get kind of thrown off is just the setup.
so, okay, we got the,
That's what, yeah, I'm looking back at this to see
so you have your order amount, which is the
48.
48, right? And then you have the, just plotted like that. And then you have, in how many,
And then
it
the
was-
concentration would be the 2 mLs and it's 48.
uh-huh. No, right there in the concentration, we're talking about the 12 milligrams and what was it? One,
Ah, okay. See, that's
One
where I
ml.
was getting.
which is going to be 4 when you divide it. Let me write it down here. Okay. Oh, and that's the answer right there. The order amount is 48, right?
Yes.
And then the concentration, they want us to give the diluent so that it can be for every 12 milligrams, it's 1 ml. So that's what it wants us to do, right? So I have 48 over 12, which is going to be 4. Once we divide it, it's going to be 4. So out of those 4, remember that there's
You have to
already,
divide it by 2.
or you can deduct the 2 mLs of the actual medication. Because remember that the 48, the dose contained in 2 milliliters. The 48 milligrams are already in a 2 milliliter vial. So you're going to deduct.
So you would, so that would give you 2. So that means that for every 12 milligrams, you would dilute it in 2 mLs.
For every 12 milligrams you wanna make a concentration of 12 milligrams per milliliter. Per milliliter. So for you want to make it every 12 milligrams 1 ml. That's what you want to make.
Got it.
And there's already in the medication itself, the vial already, it's already like this. So at this point right here, the way it is, it's 24 milligrams per ml. But we don't want it like that. We want it to be 12 milligrams per ml. That's what it was telling us. So we still have to add 2 milliliters so that it can be 12 milligrams per ml.
Got it.
That's basically what okay.
So what it's telling you is to the vial that is 48 milligrams per 2 mLs, you're going to add 2 mLs of dilution, because then with the dilution that equals 12 milligrams per ml.
Yes. So once you add those 2
Got it.
milliliters, it's gonna come
Got
to this dosage strength or concentration.
That
Mhm.
makes sense.
So that's basically what is telling us to do. So and then the rate of administration, that is not something that we come up with. That is always on the drug reference, on the literature. I always say the literature. You would always find it there, and it tells you there. And at the beginning of nursing, at the beginning, every single medication you need to make sure you wanna be sure that you're giving it correctly. But then it becomes a habit, and then you know which ones are the medications that are most given. Like I was telling you, Zofran and morphine and all of those. You know how to push those eventually. But at first, all of the stuff you will find it in the drug reference for every IV medication. So you want to follow those guidelines to protect your patient, to protect yourself as well. I didn't tell you about other medications that are cardiac medications that are when we have patients that come with the blood pressure through the roof and you want to lower their blood pressure, you don't want to push those super hard, because that's going to make a big old, when we give those medications, those cardiac meds, we always have the patient on a cardiac monitor. And then we always get a print of the EKG. We get a print of the EKG before we start pushing it so that we can see if there's a change. And then we start pushing the medication, slowly according to the literature. And then we can see if there's changes. If we rapidly infuse that, we can kill the patient, you guys. We can drop their blood pressure down to the, it's not the typical throwing up and stuff like that, but we can really make some big problems there if we don't follow those guidelines. So we always have to be like super diligent on that. The different types of administration rates, you will see that there are some that are pretty standard, that it says administer over 2 minutes. So that's, you just have to figure so that you give it over 2 minutes. There are some other types that are dose dependent. For example, when I have to give Rocephin on my patients at home, I have to do IV push, and it's 1 gram. Like, for example, this example says 100 milligrams over 30 seconds. So you have to you kind of go over, like you're dividing it over the time, over the seconds, so that you can administer it. This one says give 10 milligrams of or fraction thereof over a minute. So you have to again you have to figure it out based on the dose. You have to do so much. And there's some that are really rounded, like I said, the one gram or 1,000 milligrams of Rocephin over, it's always the same, over 3 to 5 minutes when you do IV push. So I always like to do 200 milligrams every minute. So every minute, so I'm looking at it. So I go every minute. So over a period of 5 minutes, I infuse the whole 1 gram. So that's another very common that we do. And then we also infuse IV push based on age and diagnosis. So if it's, for example, an anticonvulsant, if it's an anticonvulsant that you're given, you have to be careful. If it's an adult, you can give 50 milligrams over a minute. Or if it's or the purpose of the medication, or if it's a child, you might give it slower than that. Again, the purpose, that's with the age. That's if it's with the age, or if it's an elderly patient, you have to be careful. You give it slower on little ones versus adults, and it's usually double the time and double the time for adults than compared to children. The diagnosis is too, if you have a patient with heart problems, you don't want to push that hard because that's going to be very, very abrupt. This is an anti-convulsant medication or antiarrhythmic. There's medications that are used that they have more than one purpose. And if you're giving it for a convulsion, this is how you give it. If you're giving it for another purpose or for heart, for example, you have to do it over a different time. So that's what it means by giving the medication based on age or diagnosis.
I have a question. So you use Rocephin a lot as an example. So what's the difference if you were to give it via injection or IV push? Is it how you dilute it? Is it the dose?
Yeah, I mean, if it's an intramuscular, it's different. We normally, and it tells you there in the label, it tells you if you're going to inject it, you dilute it 2.1 of sterile water. If we're going to do it IV push, we normally we dilute it in normal saline. And depending on the patient, if it's 1 gram, we might do a 10 ml syringe, and we do 2 mLs per minute. So, but it is different because if we do it IV, it goes directly into the vein. So you might take it, you have to do it slower and you have to dilute it more than if it's injected. If it's injected, it's still parenteral, but it's going to take longer for that medication to start working and making its effect. There's nothing.
So when you're doing it intramuscular, do you also kind of slowly inject?
You also want
all at once?
all at once. Well, that's also you want to do it slowly because then it's gonna hurt. It's gonna make a big old bola, and it's gonna hurt. But you do want to give it slowly because it is painful. And plus it's really thick, and the antibiotic is real thick. So there are some medications that you quickly inject, and antibiotics you're even gonna feel it. You cannot give it fast because it's you cannot give it super fast because it's thick and it's very oily, so it's viscous. So when you inject it, it's gonna hurt too. So, and it makes no difference. And I don't know if what you're trying to say, if it makes a drastic change if you inject it fast or slow. Not really, because it's still going into the muscle, and it's still gonna work its way up, to be metabolized into the system. But when it goes directly into the vein, it's like, by the time that goes into the heart, it's going to make a big change. It's going to take minutes or, seconds for that medication to start going into the organs right away versus injected into the muscle. So it does have a longer process for it to be metabolized if it's in the muscle versus directly in the vein. Did I answer your question?
Yes, I just didn't know if like a big difference between if you were to do like an IV push of Rocephin versus an intramuscular administration of Rocephin, because I remember talking about it being very, very thick. So I didn't know if you dilute, if the big difference in that particular medication, and if you're using IV or using just an intramuscular injection, if the difference is how it's diluted, or if it's like two different medications, like Rocephin for IV push is different than Rocephin for intramuscular use is just different.
The medication is the same, I guess, just the dilution, it's what it would change. It would be different what we use to dilute them, because or we could do normal saline, but I think it's sterile. It is just sterile water. It's just more like the difference on the diluent because the way it's going to be metabolized. So most medications we always dilute with water, sterile water, and most medications that we dilute for the vein it's going to be saline, normal saline. So, but
and I just used Rocephin as an example because we've talked about it a couple of times, and I just didn't know if okay, there's two different kinds. Always be aware of
yes, always,
the one for
always
shots.
be aware.
Yeah,
that is one thing, and also how much is it going to impact our body if we do it fast or slow. So, but if it's intramuscular, it doesn't. I mean, you do have to give it kind of slow because you want to be careful with the patient. You don't want to you don't want to hurt him too much and you know, like hurt the muscle or anything like that, but it will not go faster into the system if you give it super fast in the intramuscular, because it still has to be, you know, it has to take its process to get into the system versus giving it straight into the vein. Giving it straight into the vein, it is a bigger deal. So let's see. Let me see. This is fractional dose. Let me see if this comes into the rate. Basically talks, oh yeah, it talks about the rate, the medication, like I was telling you. Sometimes we have to, you're gonna see, or you're gonna come up with medications that that give you, that the literature, for example, here, it's telling you administer at a rate of 100 micrograms over a minute. So it's telling you, the literature is telling you 100 mcgs over a minute. And the order, it's only 75 micrograms. So you're like, well, I'm not, you know, what you're gonna do here, it's kind of like round it, go over a minute. That's basically all it's telling you. We have to be able to interpret the instructions, even though the order is not 100, but in a fraction of 100 micrograms, that's how we have to go based. So if it's telling me 100 micrograms over a minute, the 75 micrograms will still fall within that fraction of 100. So if it was 175, then I would do it over 2 minutes, because that's my next fraction, or my next 100ths. So if you have, basically, that's all the slide is telling you. If you have an order that says to give 175 micrograms, you would give it in 2 minutes. You would give it in 2 minutes, because that's going towards the next fraction of 100 micrograms. So this is another example here. If you have an order, the doctor ordered 15 milligrams of a medication, and the literature tells you that to give each 10 milligrams over 1 minute, or fraction thereof over 1 minute. So you have 15 milligrams. So the first 10, right? The first 10 milligrams would be 1 minute, and then the remaining 5 will be the fraction thereof, you know, like the next. So you will go a whole minute for the remaining. Even though it's not 10, you will round it to a whole minute. That's basically how we calculate in by following the term thereof. You know, anything thereof will be another the next minute. Okay. So right here we have a sample. The nurse is to administer 30 milligrams of furosemide, direct IV. Furosemide is a diuretic water medication to get the water out of the body. And that is also another one. If you get a lot, if you push it fast, it can drop your blood pressure. So you want to do it slowly. And it says to administer at a rate of 20 milligrams per minute. So how many minutes, what is the rate of administration for this dose? What would be the rate of administration for that?
2 minutes.
2 minutes, right? Okay, so the first, see, the order is 20. So the first 20 minutes is 1 minute. And the remaining, because it's part of the next fraction or thereof, it will be another minute. So it goes to 2. That's basically what that how about this one? My order is Lorazepam, 3 milligrams IV push, and my literature says IV, adults IV, 4 milligrams, inject slowly at 2 milligrams per minute. So over how many minutes would I administer this?
So it would be 2 minutes?
Mm-hmm. Yep. It would also be 2 minutes. This is my order. So it says 2 milligrams per minute. So 3, I got the first 2 are gonna go over 1 minute. So I have 1 remaining. So this is the fraction thereof. So this is gonna be another minute. So it'll be 2 minutes too. Basically, that's what it is. All right. I know it's a lot of content, very little time.
So that's how you would set it up, how you did just a minute ago, where you write 3 milligrams, and because it's 2 milligrams per minute,
Mhm.
then you would do the remaining milligram at a minute, so that would equal your 2 minutes.
Yes, yes.
Okay.
That would
I'm
be
sure
the-
there's gonna come a time when it's not that simple.
yes.
Okay.
And then this last one is not very long either. This is talking about titration of IV medications. Okay, and that what we just went over right now of the figuring out the rate of administration of medications, that we have to like, okay, we follow this guidelines, so that's why we do 2 minutes or 4 minutes. There is also that for titrating IV medications. So we are given as nurses, sometimes we are given orders and the doctor might say, titrate this or titrate this medication to give this blood pressure medication to titrate the patient's blood pressure to remain less than 160 and the systolic and more than and to keep it greater than 90 the diastolic or something like that. So sometimes we're given that much of, not layaway, but we're given that much of responsibility. So we have to follow titration of IV medications. Okay, so basically that's all the doctor's going to say. Another example and a quick one is oxygen. They give us this order a lot, like all the time. And oxygen is a medication, you guys. So the doctor says, administer oxygen to maintain the oxygen saturation greater than 94. Boom, that's it. That's the order. So we have to titrate the oxygen to be able to maintain the oxygen level greater than 94. So we might start the patient at 2 liters, 3 liters, 4 liters, depending. So same thing for pain medication. Pain medication, they always tell us like, or they give us orders to maintain the patient's level of pain within acceptable limits. So we might have more than one medication order to treat the patient, and we have to follow these titration measures so that we can do. And there's a lot of medications, you guys, that we have to use titration to be able to achieve the goal or what is being ordered to us. There is anticoagulant medications that we are given, and we are normally basing ourselves on the blood results. And we see the blood result, and then we're like, okay, continue giving this, the Coumadin or this anticoagulant to keep maintaining the blood within those parameters. So, and all you get from the doctor, it's an order that says titrate Coumadin to maintain the the Coumadin, the PT-INR levels between 2 and 3. That's all. And that's all we're given. So we have to titrate medications, and this type of medications that we titrate, it's either by continuous infusion or in the pump, or something that we would end up administering on our patients. So we are very responsible for assessing our patients and checking our patients. So when we're given this much of responsibility, we have to continuously be monitoring our patients, checking their blood pressures, checking their cardiac rhythms, and blood work to be able to continue these orders. This is when the amount of responsibility gets this big, because before because it's a big responsibility. So we have to continuously be checking our patients and see how they're progressing. There are different types of titration protocols that we follow. One of them is that titration per protocol, which is based on a protocol that has been developed at the hospital maybe, or nationwide. Sometimes we adopt those type of protocols as well. So and these are protocols that are made, like I said, based on different pharmacists, doctors, and nurses. So, and we already have them built. Like in the emergency room, we have all kinds of protocols. We have protocols for, even for the COVID protocol, we have one now that we have to follow all of those orders. So that's one type of protocol. The other one would be the type of protocol that we do based on parameters, or based on the patient's physiologic changes. And that means based on the patient's progress, based on the patient's improvement, then we follow those protocols, those guidelines. These parameters could either include blood pressure or blood values, or how is the patient feeling, the patient pain, the level of pain, and that's how we titrate those orders as well. Okay, so the information that we need in order to solve problems or titration problems, well, we need what is the information of the IV bag, the total amount of medication that's being ordered, the volume that needs to be infused, that information, what type of titration are we doing, and also over what is the period of time. So that is when this solving components, or like the abbreviations, I would suggest, because that you guys memorize that the TD is the total drug, and then we have TB, which is the total volume, and then the hour HD, which is the hourly drug. And this would help you guys solve the titration problems much easier. And in dimensional analysis, this is just an example of how you get, right here in the top, it says order amount. Order amount will be the dose, or the hourly drug, I'm sorry, the hourly drug. And then in your conversion, this is how you will set it up. The total volume and then the total drug, which is going to be equal to the hourly volume. Okay, so you see them here, the way they're broken down, and the way that I want you guys to set them up. And then it gives you an example so you can see. So we have the 20,000 units, that's the order amount, and 500 milliliters of D5W at 500 units per hour. So we have the 500, the total volume, 500, right? And then it says, where's the total? This is the order per, okay, this is, okay, let me read again, I'm sorry guys. The prescriber orders 20,000 units in 500 milliliters at 500 units per hour. So the 500 units per hour, that's what's actually ordered. And this is the dosage concentration. Your total drug, 20,000 units, and the total volume. Every time I say volume, that's how many mLs. So the total volume, it's in 500 mLs. So you have to solve for that. When you solve for that, you're gonna, cancel, and then you're gonna be left with a lot of zeros that you can cancel all those 4 zeros, and you cancel them out. And then it's gonna be 12.5 at the end, which you need to round it because we're talking about an IV infusion. So you will round it to 13 mLs per hour. So that's how you will solve this titration problem. Okay, so the setup, so remember the setup. I even write it down myself here too, because sometimes all right, so let's work one problem and see. You have the order.
Oh, I'm sorry. I didn't know I was unmuted. I was trying to do it by myself, the one we were talking about. So I wanted to see if I got it right.
Did you?
I lost myself.
Oh, okay.
Yeah, I think I did. Yes, 12.5.
It's gonna be 13. So you have that order. It's morphine, 50 milligrams in 500 milliliters, and it says that at 4 milligrams per hour. So the first thing we want to do is put the order amount. So where would I put it first? I'm gonna put the 4H. So then going back to this one, you guys, so you want to put first the order amount and then do the conversion. So I got my order amount, which is going to be 4 milligrams. And then in my order conversion, I have, remember in the top, I'm going to have total volume and then total drug, right? And then my total volume, remember volume is going to be mLs. And then in the bottom will be the total drug. And this is the hourly drug. So cancel. I think it's that. Yes. Divided by 50, can cancel 1, 0, 1, 0. So my answer is 4 mLs per hour. Okay.
So you would do 40 mLs per hour to like maintain whatever you're trying to maintain?
Yes. Because remember, they're giving me the order. The doctor's gonna come in and he's gonna give me the order and he's gonna say, I want you to give this much hourly. But when we set it up in the pump, we are the ones that we actually set up that, you know, like we're gonna set up the how many mLs an hour is it gonna be to give the 4 milligrams per hour. And some doctors, they're really cool and they do the whole thing, and the pharmacy would as well, but we still have to double check. And then when we have to do this type of titrations, we are normally dealing with high risk medications. Like in this case, look at 50 milligrams and 50 ml. So we're giving 4 milligrams. That's still a lot. 4 milligrams of morphine, that's still quite a bit. So traditionally you want to give 1 milligram, 2 milligrams. So when we do this titration, is because we're dealing with higher doses or strong medications. So yeah, we have to like read the question. What hourly volume? Hourly volume, that means ml per hour. That's basic. Every time we read volume, it's mLs per hour. And then when we know we have to set them up in the pump, then we know it has to be ml per minute. Okay. Some titration problems will require a little bit more of the conversions and adding more conversion factors into the problem. For example, here the doctor is ordering max sulfate, and that is a really strong muscle relaxant. We use this a lot on pregnant women to try to, when they want to go into early labor or they have preeclampsia, they have high blood pressure. We want to relax their muscles to try to prolong the labor so that they don't go into labor. So this is a high risk medication, big time. So the order is 200 milligrams per hour, and this is what's available. Magnesium sulfate, 20 grams. So that's what, 20,000, right? Milligrams in 500 mLs of normal saline. And this is a real order, you guys. So we have to like figure out how many mLs per hour do I need to set up the pump to only give 200 milligrams per hour on my patient. So when we have to add more conversion factors, is we have to convert the milligrams into, the grams into milligrams, and or utilize the line metric system so that we can get rid of all those zeros. Okay, so that's one example. Sometimes we have to titrate to milliliters per minute. So And an example of that would be nitroglycerin. I don't know if you guys have heard those medications. This was really sorry, it's I'm having a moment. Cardiac medication, nitroglycerin is really strong, it's really fast, and this one says to give 10 milligrams per minute. So we have to convert. If we have a supply that is coming we have to put it in a pump, we have to set it up per hour. So we have to convert that into, as we did earlier. That's what we have to do, like add a conversion to that to convert them. So these are, this is how you would kind of like work it out. If you have to titrate, if you have to work a problem and convert a problem that needs titration. So it gives you the formula. An example there says the MD orders Diltiazem, that's another heart medication, and it says 14 milligrams per hour. So, and the nurse has an IV, and it's like 0.125 grams in 500 milliliters of D5W. So you have two ways of working this out, using dimensional analysis, or much easier, if you start off, 1.25 grams, so you have to convert it into milligrams. So utilizing our metric system, gonna be 1, 2, 3 jumps to the right. So all you have to do is move this decimal 1, 2, 3 to the right. And then you know already that 0.125 grams is actually 125 milligrams. Okay, so these are the most typical, guys. And then you get to memorize it. I'm sure you probably already are memorizing that every time you have to convert from grams to milligrams, you go 3 spaces to the right. And if you're in milligrams, you want to get grams, you go 3 spaces to the left. So it becomes, part of your knowledge. So you can do that, get that done. And then the total volume, we know that's the 500 milligrams. The hourly drug is the 14, because it says 14 per hour. And then the hourly volume, that will be how many milliliters per hour, which is what we're looking for. So we can solve it those 2 different ways. Okay, so and then the minutes, if you do have minutes left, the same way as we did earlier, if you have minutes left, you're going to do the conversion as I taught you earlier, to convert that into minutes. If you have a fraction, if you have a fraction, like this case 0.4, I want you to use dimensional analysis so you don't get confused. But use dimensional analysis for that, and then you get the remaining portion. But it still gives you an example here on how to figure how many milliliters milligrams per hour you would give. So let's work this problem. And I know it gets more and more complicated. So it's, I need to know the hourly volume. So I know this is what I'm looking for. And my order says 500 milligrams and 500 milliliters. So if I start with my hourly drug, and then my total volume, what's my total volume? 500. And then my total drug, which is 500. And it's asking me, and this is per minute. So I want to convert that into hours. So I got cancel milligram, minutes and minutes, and I'm left with mLs per hour. So I don't know if you guys are already multiplying there for me. 50. Did you guys get the same 9,000?
Yes.
Yeah, okay. And then in the bottom, I think I only have 500, and now I'll get rid of the 2 zeros. If I divide 90 over 5, it's gonna be 18. Jeez, that was a long one. So that will be my answer. 18 milliliters per hour. Okay. You guys are okay?
Yeah.
Kind of, sort of.
No, yeah. So where it says 0.3 milligrams per minute, like, no, you don't need necessarily per minute because it's IV pump.
Exactly. So,
Got it.
so that's the doctor's order. That's the doctor's order. So remember that we have to set it up in the pump. So when we set it up in the pump, it has to be mLs per hour. So we have to convert this. We have to convert it into hourly, in an hourly rate. So. And that's why it can get confusing sometimes. But in our doctor's orders, that's how they make them, and then we have to like, and you'll see in the pharmacy, normally they get them, they do it for us, but we have to like work them out again, so to make sure it's okay. The titration orders based on weight. Sometimes we have to, the doctor's going to tell us or give us the order based on the weight of the patient. So this is when it gets a little bit more, more not so much complicated, but it gets longer because you have to keep track of all of the different conversion factors that you have to add into your problem to make it work. So, and this is one that the doctors love a lot, giving orders titrating weight based on the weight. So this particular order says amyophyllene 200 milligrams into 50 mLs of D5W at 0.8 milligram per kilogram per hour. Híjole. So now they added, it's not per minute, it's now per kilogram per hour. So if the patient weighs 25 kilos, then you have to figure out how many mLs or how would you set up the pump. So that means all this problem means is that you have to add more conversion factors, more conversion factors to your problem to be able to determine. It's not impossible, it's just a little longer. And then on top, sometimes they don't even put this, they put pounds. It's pounds, so we have to convert it all with the pounds. So before we even do the problem, let's get an idea. The total drug we have, it's 200 milligrams. The total volume is the 250 milligrams. The hourly drug they want us to do is 0.8 milligrams per kilogram per hour. So, which is equivalent if you multiply it by the kilos, because the patient only weighs 25 kilos, 25 times 0.8 is 20 milligrams. So it's actually 20 milligrams per hour that we need to administer. And then it says the hourly volume, that's what we need to look for. So basically the setup is the same, only that we have to get the kilos in the problem and multiply that by the weight, by the dose that is given to us. Okay. So, and then you calculate the rest. Okay. So every time you guys read that it says using any of the 4 methods, remember that's dimensional analysis we're looking for. So we have that order there. And I have dopamine. It's an ICU drug. It's a medication we use to elevate the blood pressure on the patient. And it's a medication that's only given in the ER and the ICU only. And it's saying start the 400. Let's do the setup first. It's telling me my order is 2 milligrams per kilogram per minute. Okay, so the patient weighs 55 kilos. We can solve that if we want to. We could solve it. It's 2 mcgs per kilogram. So 52 per 2, I mean 10 per 2 times 2, right? 110. So we already know that we have to do 110 micrograms per minute. So it's per minute. So we got that. And I'm looking for milliliters per hour. So first, my ordered dose is going to be the 110 mcgs per minute. My total volume is 250. My total drug is 400. And what else? I need to convert my minutes to hours because I'm gonna do it on the pump. And then what else do I need to convert here?
The micrograms, the milligrams.
So 1 milligram is 1,000 micrograms. And another thing that I can do is use the metric line system so that I can go from NCGs to milligrams and convert them beforehand. So I have to multiply all of this. So 110 times 250 times 60 times 1, and then divided by the 40,000 in the bottom. So when I do that and I cancel out my zeros, I know that the answer is going to be really small. The answer is going to be 4 milliliters per hour. So, and I could multiply it all if you guys are not doing so already. Times 60. And then 4. Huh?
Oh, I'm talking to myself.
No cussing.
Big numbers.
Yes, big numbers. Let's see, go. 1, 2, 3, 4. 1, 2, 3, 4. I do love to get rid of zeros. So I got 165 over 4. So, and then I have the 4. Was it 165? Yeah, I think I got 165. So my answer is, what do you guys get? I got 4 milliliters.
Equals. So that would be 4. 5.
So that's a lot of zeros in there.
Yes, because it's 4.1.
Mm-hmm.
And
So
you don't keep that, so it's just 4.
and it stays at 4. So a lot of zeros you need to like really over cancel out later on. But it turns out to 4. So that's where you need to practice a lot on those problems. And then the last portion of this chapter, it's when we have to adjust titration per protocol. So this is a protocol, you guys. So it's really nice, very cool, very convenient. I love it. And this is an example of a protocol, and this is on a medication heparin. Heparin is a really strong anticoagulant, so it thins out the blood. So when it's thinning out the blood on the patient, we have to make sure that we are, as we are thinning out the blood on the patient, we have to constantly be getting blood work to see how thin is the blood. So if we are following the protocol, and then the doctors go adjust or titrate or adjust the medication based on the lab results or a parameter. So in this case, this protocol says the PTT, you guys, the PTT, what that means is that how many seconds or how long does it take for the blood to start clotting. So based on this clotting time, we have to infuse the heparin. So if the doctor says maintain the blood aquí, right here, 55 to 70 seconds per minute, it's what is what the doctor wants to keep the medication and he wants this long for the blood to start clotting. So they want to keep it here, keep at current rate. So, and if for some reason the blood comes, the blood work comes back to this, to 45, you have to increase the dose by 50 because you want to keep it at this right here. Or vice versa, if the blood back, the PTT level comes at greater than 125, that means that the blood is really, really thin and the patient's not clotting, which could lead into a bleeding, internal bleeding on the patient. So if we get this greater than, we have to let the doctor know right away, or decrease, decrease the heparin from infusing. So that's how delicate it is. Like if a nurse, and I have seen this, guys, if a nurse does not check this protocol and they're giving heparin and the patient's blood, they could bleed out inside. So that's how delicate this is. So we have to really follow these protocols. We have to keep on following this protocol so that we can adjust, either give more heparin or decrease the heparin because it's causing the blood not to, we want to keep it always at a level. Okay. So following the protocol, you have an IV heparin, 25,000 units and 500 milliliters that was started at 300. It was started at 300 units per hour. It says that, let me see where it says the lab result. A standardized heparin protocol is to be used to adjust the dose based on the PTT lab result. 6 hours after the start of the infusion, the PTT is 50. So somewhere around here. The nurse will adjust the IV rate to how many milliliters per hour. So that's where the tricky. So we know for sure that if the PTT is 50, right? Do I have to increase or lower the infusion rate?
Increase.
I have to increase it by 50 units, right? So I have to increase it by 50 units. So I have to make my problem so that it's 350 here. So we would still have to plot in the order. So it would have to be 350. Where's my pencil? It would have to be the 350 as my hourly. My 350 as the hourly. And then I would do the total volume, 500, and then my total units, right? So, and I have to know how many mLs per hour, how many mLs per hour am I going to now give the medication, the infusion? So once we work this out, you're gonna, I don't know if you guys are working on it already, but this is 350 per how much per hour? So all I have to do here is cancel ml per hour. So when we multiply the 350 by the 500 and divide it by the 2500, my answer is gonna be 7 mLs per hour. And there's a way to cancel out the zeros before you start multiplying. I know the new generation of students, you know, that they're like really good in canceling zeros out. I'll tell you the trick next time. So just so we can get it, 350 times 500. Get that down. So 175 divided by the 25,000. So cancel the zeros. So 175 divided by 25, it's gonna be 7. It's gonna be 7 something. Oh no, it's 7 even. So it's 7 milliliters per hour that I need to now increase the infusion. You guys, yeah, you're good?
Yeah, where did you get that 250 from? Is that supposed to be the 25,000 units?
Oh, we're gonna plot them the same way. Watch, hold on. Remember we following the same, let me see if it fits here. There we go, right there. So the hourly, what was the hourly? Okay, the hourly is, we have to increase, right? Based on the lab result, we have to increase 50 units, right? We have to increase 50 units, and the patient currently is getting 300. So now we
Right,
have
so that
to
would mean
bump it up.
350.
That would be 350. I'm trying to go to the next slide. Okay, so that will be 350 units per hour. So when we plot it, remember we want to get mLs per hour. So when we plot it, the total volume is 500 mLs. No. In the 25, yeah, in the 25,000 units.
Okay.
That's right. That's where it says.
So
right.
then you canceled the zeros. So it was 5 over 250.
Yeah.
Okay. I guess that's where I got lost.
Yeah, and then you get that. So when you do that part and you multiply this 2, it's going to be 175. And then the bottom we have the 25. So I got rid of the zeros. And I ended up with the 175 over 25, which is 7. And like I said, I know that
Yeah, I got it.
all right. So that's, and then I mean, just, you know, I think I already mentioned this, when we have to utilize parameters, we utilize parameters based on laboratory results, or in some cases, like based on vital signs, like this order here says titrating 3 micrograms per kilogram per minute every 10 to 30 minutes until the blood pressure is greater than 60. So we have to like keep on doing it until we get the blood pressure as desired. So based on those parameters. In that particular order, you will see in an ICU patient or an emergency room, really delicate patient. So, but we get those a lot. That's it, you guys. This one.
When we get questions like this practice problem 4, so do we need to memorize this chart, or does this chart change depending on what the doctor has ordered? Right.
this chart, like the chart.
Yes. Yes.
There is because there are different protocols there. I mean, you in the hospital and no, you don't have to memorize the chart. No, not at all.
Okay. So if we get a question like this on the test,
You will
will
be
it
given-
include the chart? Okay, cool.
Yeah, you will be given the protocol because there's all kinds of protocols. So there has to be a protocol built, and then from there you will like, oh yeah, I have to increase, or we have more than enough already as it is, just by having to figure out how many mLs per hour by increasing units or decreasing units. So the protocol is already done. But it
Got it.
does
Thank
save you,
you.
it does save you a lot of time providing patient care, because before we used to call the doctor, get orders, and then get back, and now we're given more, I don't want to say responsibility, but we're given more independency to do things like that. But I always tell students, be careful, don't just like try to, I mean, take it lightly, because this protocols are made so that we don't create errors. So so that's mainly the reason why we want to provide the best care to our patients. So